Evening to each one of the young girls who are here. Today, I'm going to be talking to you about polycystic ovarian syndrome. I know a lot of young girls here and a lot of women in the reproductive age group, especially the ones who are not able to conceive, wish to know more about this condition because we have seen that nearly 30% of the women are found to have polycystic ovaries. So, first of all, before I start, I would like to talk about the difference between polycystic ovary and polycystic ovarian syndrome. That's PCO and PCOS. Polycystic ovary is a finding that we get on ultrasound. It consists of the ovaries, which are a little bulky, a little bigger than the normal ones. And they're said to have many small follicles, which are only about 1 to 2 millimeters. They're all arranged circularly around the periphery of the ovary. It has been seen that if I do 100 ultrasounds for the young girls, about 20 to 30 of them will have this type of ovarian morphology. This is called polycystic ovaries. But when these girls who have this type of polycystic ovaries tend to have symptoms, symptom means they have irregular periods, periods which are coming more than 35 days later. Sometimes they have very less bleeding during periods. Sometimes they present with problems of irregular continuous flow of periods. Or they have symptoms of acne, very disturbing acne which is present on the face, a lot of hair on the body. Generally, we see hair on the face, that's on the chin, as well as the jawline and neck. But yes, they can have hair on the body, on the abdomen, around the breast. These three things together are the symptoms of polycystic ovaries. And when they are present with such ovaries, we call them as polycystic ovarian syndrome. So, who are the people who are likely to have the syndrome? It has been seen that the girls who are obese, who have a BMI which is more than 27 or more than 30, they tend to have the symptoms much more than the thin, lean girls. Not to say that thin, lean girls do not have polycystic ovarian syndrome. The question that comes to everyone's mind is that is my periods irregular? That is why I'm obese, or because I'm obese, the periods are irregular. So I would like to over here say that it is obesity, it's your fat deposits in your body, which tend to make you more prone to have the symptoms of polycystic ovaries. Because the fat also produces the same hormones that your ovary does. As a result, the estrogen, that's the hormone, is much higher. You get irregular periods and you have a problem. Further, the fat that you do have makes you more resistant to insulin. That is, to your glucose tolerance goes haywire. If your glucose tolerance goes haywire, you have higher levels of insulin, which itself tends to lead on to these particular symptoms of polycystic ovaries. So, the question that I would like to now talk about is how do you diagnose polycystic ovaries? Many girls walk into the OPD, they have irregular periods, and the first thing they ask me, do I have polycystic ovaries? Yes. If you do have the symptoms, you are likely to have polycystic ovaries, but the diagnosis and labeling you as a polycystic ovaries depends if you have any two of the three criteria, which is based on the Rotterdam's criteria. That means irregular periods, presence of acne or excessive facial hair, or blood tests which are suggestive of you having high levels of testosterone. And the third is the ultrasound finding of characteristic polycystic ovaries. If any two of these three symptoms are present, then you are labeled or you're diagnosed as polycystic ovaries. Further confirmation is done by doing certain blood tests on the second or the third day of the periods. We do them specifically on the second or third days because we're testing the hormones which are released by your pituitary, the part of your brain. They are the hormone study like FSH, LH, estradiol. But the best way to tell you is that if on the second or the third day, you get up something, a blood test called PCOD panel, which contains a series of tests, which apart from the basic hormones, also looks at the level, that is whether you have certain hormones which are increased, your testosterone levels are high, which leads to acne as well as hirsutism. It also looks at your glucose levels, at your insulin levels, your lipid profile. All these things together can be done on the second day under the PCOD panel, which further confirms not just the diagnosis, but also whether you are liable to develop any of the other risk factors. That is hyperlipidemia, where your lipid profile is much it is out of control, or the underlying a diabetic level is there or not. So, having diagnosed based on your clinical symptoms, based on the ultrasound findings, as well as these particular tests that I have just mentioned, you may be called or referred to as having polycystic ovarian syndrome. The next question that we all need to answer is that how to be treated. First of all, I would like to break the myth. There is no surgery for polycystic ovaries. The word says cystic, so everyone thinks that they're going to be a little big cyst, 2 centimeter, 3 centimeter, 5 centimeter, with a lot of water inside, but no, that is not the thing. These are small little follicles which are present. It's a hormonal condition, and hence there is no surgery at the outset for polycystic ovarian syndrome. The treatment, the mainstay of the treatment lies lifestyle modifications. You Google it, you read it in all books, the first thing that comes is a lifestyle modification, which means that you need to bring your BMI down, you need to lose weight, both by exercise as well as by diet. It goes hand in hand. A very good personalized diet plan, as well as a personalized going to gym or carrying out your own exercises, bringing your weight to the standard one. That is a BMI which is somewhere about 22 to 25. It goes a long way in getting your periods regular, in reducing your acne as well as your facial hair. And that is, I would say, the mainstay. It's difficult. I know it is difficult to lose weight. Many of the girls have been trying very hard, but it's difficult to lose weight. But if you have the desire and if you have the right person to mentor you, there is no way that you'll not be able to lose weight, and have lifestyle modification itself will be enough to treat you. In case this does not help you, in case despite losing weight, we find that you are not able to get your periods regular, or you have acne or hirsutism, then the girls who are not looking for a pregnancy, they are started on a hormonal treatment. The hormonal treatment basically contains estrogen and the progesterone. And the type of progesterone varies depending upon your symptoms. They're given for 21 days, you get your periods again 21 days, and they are continued on. And they can be continued on for 6 months, 1 year, 2 years, 5 years, or till you wish to get pregnant. It is the progesterone which actually changes, because if you have acne, if you've got hirsutism, then there's a specific type of progesterone which has a good anti-testosterone activity, anti-androgenic activity. As a result, it works better. Your acne will improve within a period of 3 to 4 months, but the facial hair takes a long time, sometimes about 1.5 years, 2 years, for it to really become effective. But mind you, once the treatment is stopped, it may again reappear. It may be a period of 3, 4, 5 months, when after the stopping the treatment, you may be fine. But yes, it may tend to revert back if we have not undertaken lifestyle modification as the main basis. If we are still obese and have not lost weight, are not onto regular exercises, there are very high chances that when you stop, it may tend to come back again. So, the modality of treatment is predominantly lifestyle modification as well as the hormones, which are both estrogen as well as the progesterone. And these hormones can be continued up till you want to get pregnant. The second group of patients are the ones who are looking to get pregnant. And they have polycystic ovarian syndrome, as a result of which they do not get periods in time. When they do not get periods in time, they are not able to ovulate in time. And if they're not ovulating in time, getting pregnant gets very difficult. So, girls who have polycystic ovaries are often recommended that once they get married, they should not delay conceiving. They should try and conceive fast because more they tend to delay, they may require certain artificial methods or support to get pregnant. So, once you decide that yes, you want to get pregnant and you're not able to conceive on your own, it's best to contact an infertility specialist. All she is going to do is going to carry out the basic tests to rule out all other causes of infertility, which includes your husband's semen analysis, which also includes a detailed ultrasound, your hormonal treatment, your thyroid, your prolactin, as well as your sugar and hemoglobin levels. After that, if everything else is all right and it is only your regular periods of polycystic ovaries which is not allowing you to conceive, we start you on ovulation induction medications. Those are oral medications which are given from the second or third day of your periods for a period of 5 days. And we follow it up with follicular monitoring to see whether it is responding, whether your egg is coming up. And once your egg has come up well, that's about 20 to 25 millimeters, you may be given injections to rupture the egg and put you on to timed intercourse. That is to allow you to conceive naturally. The first cycle will tell us whether these medications are good enough for you to conceive, or we may have to add some injectables. If that doesn't work, we may have to combine it with intrauterine insemination. What I'm trying to say, that a polycystic ovarian syndrome girl, there is no reason for her to feel anxious or depressed or to feel that she cannot become pregnant. Even if becoming pregnant naturally is difficult, we have enough of medications to help her to get pregnant. And many of these are very simple techniques. So just giving some medications to help her make eggs, follow it up with self-intercourse. If that does not work, we move on to IUI, where intrauterine insemination, along with these particular medications to make eggs. And if about 6 or 7 cycles also does not work, then of course we have the IVF, that is in vitro fertilization. There are techniques, there are methods available, and pregnancy is a reality and is a possibility. All you need to do is to be positive, is to seek help at the right time, to be undertaking good lifestyle modifications, and to move ahead along with one fertility specialist that you choose. And there's no reason that we'll not be able to help you to get pregnant. The next thing that I would like to talk is about the long-term effect of polycystic ovaries. Many girls are lucky to get pregnant themselves or by the methods of ART. Majority of them do get pregnant. But important to understand that this particular polycystic ovaries is a metabolic condition. Later in life, about midlife, maybe about 35, 40, 45 years of age, if we tend not to continue with the lifestyle modifications, there's a higher chance of you to develop diabetes, heart issues, increased lipid, as well as to remain obesity and its associated complications. Hence, this is an ongoing process. We need to work on ourselves throughout to be able to prevent these conditions. And that is something that we all need to understand. That polycystic ovarian syndrome is an endocrinological condition. It's a hormonal issue. We need to work on it lifelong. And also, lastly, just a word that it also has some amount of genetic variation, because many girls can come and say, why me? Yes, about 10 to 20% of you may have inherited it from your mothers, or your sisters too may have the same problem. But predominantly, it's a condition of lifestyle. So at a young age, if we get on working, we control our weight, we do regular exercises, have homemade healthy diet, then chances are very good that we will be able to deal with polycystic ovaries, because we are born with it. We have to live with it. But we can prevent the symptoms and the effect it has on our body and our mental status. So thank you very much. So I would just now like to see if there are any particular questions that we can address and we can talk about. So the first question that she has asked me is, doctors, who can get polycystic ovaries? So I think I ended with this particular point itself, that polycystic ovaries, just in 10 to 20% of cases, is genetic. It is present in our mothers. When we take a history, we find that the mothers too have had it. The rest of them, 70 or 80, we really do not know what the cause may be, but it is considered to be a condition of lifestyle, where the girls who are of young age found to be very obese, who have a lifestyle which is very sedentary, they tend also to have higher chances of having the manifestation of polycystic ovaries. Again, I would like to reiterate the next question, that what are the symptoms of polycystic ovaries? How do I know I have polycystic ovaries? Here, one thing I would like to say is that immediately after you have had your menarche, that is your first periods at the age of 10, 11, 12, for the first 3 years, the periods may be irregular. You may not be getting periods every month. It may come every 2 months, every 3 months. This is one of the symptoms of polycystic ovaries, but we do not label any adolescent girl a polycystic ovaries till 3 years after the onset of menarche. If after 3 years her periods continue to be irregular I mean is more than 35 days, less than 8 cycles a year, they have very less flow during periods, they may have continuous bleeding in between, or it may not stop for 10 days, 15 days. Or sometimes some girls come with very fast periods. Every 10, 15 days they're having periods. That is one of the major symptoms that the girls do come, and we find that they have polycystic ovaries. Another symptoms, the others are because of the high androgen, that's male hormonal levels in the body. So they may have acne on the face. They have terrible acne which they've been to dermatologist and they do not respond. Then the dermatologist tells them to go and get the investigations for polycystic ovaries done. And they find that acne is one of the symptoms. And the third is the presence of hair, which may be present on the face, on the tummy, on the breasts. For the girls who are trying to conceive, if they have infertility, are unable to conceive, that is yet another symptom of polycystic ovaries, because they do not have regular periods, they do not ovulate every month, and thus conception too becomes a problem. The next question someone has asked over here is, how is PCOS diagnosed? So, of course, as I've said, the symptoms are the main factor. First time the girl generally comes are the symptoms, as I've said, of irregular periods, acne, hirsutism, or infertility. Based on the symptoms, we carry out certain investigations. These investigations are predominantly hormonal. Along with the hormonal investigations, which are carried on the second or the third day of the periods, we also carry out tests to find the metabolic effects of this on the girl, that is the lipid profile, the sugar levels of the patient. And most important is to do an ultrasound. For the young girls, it's done from the tummy. We ask them to fill up the bladder and come. For the girls who are married, we do an internal ultrasound to be able to see the ovaries. The ovaries are bulky. They're not very big or large, they're just bulky. The volume is what we look at. If it's more than 10 cc, it's more suggestive. The number of follicles we look at and how they are arranged in each of the ovaries. And that helps us to diagnose polycystic ovaries. Now, the question is there a cure for polycystic ovaries? I know this troubles all the girls. How can I get rid of polycystic ovaries? Many come saying we are tired of taking treatment for polycystic ovaries. Madam, do something that this just goes off. But again, I would like to reiterate that you're born with the polycystic ovaries. These ovaries are going to be there always in your body. We cannot remove them. But we can control the symptoms that arise from this polycystic ovaries. We can make our periods regular. We can take care of the acne. We can stop the hair growth. We can even improve our fertility. And the treatment of this lies in, yes, again, lifestyle modifications. And depending upon your symptoms, the hormones which we need will depend upon your symptoms. And if inability to conceive is your main problem, then we give you medications to do it. We cannot rid or completely remove polycystic ovaries from its root. We need just to control the symptoms and take care of them. And if you are compliant and if you are really determined, there's no way that polycystic ovary will trouble you. You'll be able to control it with your symptoms and be free from the effects of it, especially the anxiety, the depression. Some girls have a lot of hair on the face. They are obese. They have very low self-esteem. They are unable to go out. They're not happy with their habitus. But if they're determined, they can control it. If they come to the gynecologist, we can help them with the medications. The dermatologist with the excessive hair, and they can come back to normal life and be one with everyone. Now, the next question that she asks is, PCOS will affect conception. You may have polycystic ovaries, but if your periods are regular, if your weight is in the normal range, you will not have a problem in conception. You'll be able to conceive naturally. The problem comes if your periods are irregular. We do normally an ultrasound in one whole cycle to see whether your eggs are naturally developing, becoming big, and rupturing. If it is happening naturally, then there's no reason why you should not be able to conceive if there are no other factors which prevent your conception. But in case your periods are not regular and you're not ovulating, then yes, you may have a problem in conceiving. But we have enough medications to help make those eggs, to help them rupture and to help you conceive. We move from ovulation induction to ovulation induction with intrauterine insemination. If that does not work, then we have two options. We may even advise you to go for an IVF, or some select patients, we may even do a laparoscopy. That is, we enter into your tummy and make small holes into your ovaries to make them more responsive to our medications and to help you ovulate by their own self. There is hope, and be sure that you will be able to get pregnant. The technology of art, of infertility management, is very advanced. And we do not leave a single woman behind. We have enough medications, enough methods to help you get pregnant, provided you keep your spirits high, you persist, you persevere, and you remain positive all throughout. So, as far as polycystic ovaries is concerned, I would like to tell each of you girls that the girls of polycystic ovaries are the most beautiful girls that we have seen. They generally have a glow on the face, but they come to us a little depressed, anxious, upset. And I always tell them that I have not seen a beautiful girl than you. You need to bring out your beauty by first of all becoming mentally strong. Secondly, stop blaming yourself that why am I suffering from it? Instead, take responsibility of the situation. Get a diet plan. Get on to regular exercises. Contact your gynecologist. Take the right treatment. Hormonal therapy is the mainstay of the treatment when you're not looking for a pregnancy. Don't be scared of taking these hormones. They regulate your cycle. They get your periods in time. They bring your hormones to normal level. They reduce your acne. They help control the excessive hair on your body. These drugs are safe. These drugs do not increase weight. These drugs do not affect your fertility or conception that everyone has. Instead, they improve your chances of being conceiving. And these but till you wish to get pregnant. So with this, I would like each one of you young girls to please seek medical help. If you feel you have symptoms of polycystic ovaries, and it is not only you, there are many like you. Among your friends, if you sit down and talk, you'll find many have irregular periods. Many are suffering from polycystic ovaries at different levels. Lifestyle modifications are mainstay. Regular exercise daily, a healthy homemade diet. You can even contact your dietitian and be in contact with her. With a good dietitian as well as a determined you, I've seen girls lose approximately 10 to 15 kgs within the next 6 years. I have seen so many of my patients of polycystic ovaries who have lost weight. They become even more responsive to my treatment of infertility and tend to conceive in the next 1 or 2 cycles. Once you do conceive, then women with polycystic ovaries need to be a little more careful during pregnancy. They may require initially some amount of progesterone support because it is found in literature and in evidence that polycystic ovarian girls may have a higher chance of miscarriage. They may have diabetes somewhere along down the pregnancies. So we need to be monitored. We need the pregnancies to be well monitored. You may get an extra progesterones. You get your sugar level tested. And once they are in control, you will soon have a lovely, healthy baby in your arms. So with that, I'll come to the end of the session. Meena, anything else that we have any questions or? So with that, I would just come to the end of the session telling each one of you that polycystic ovaries is nothing to be scared of. Do approach your gynecologist or infertility specialist the moment you feel you have it and we'll diagnose and help and treat you. Thank you so much. Meena, I think you'll need to unmute yourself.
Yes, yes, ma'am. That was a lovely session with you, ma'am. Thank you for joining us, everyone. Thanks, Apollo Cradle Children Hospital, for the lovely session we had with the Dr. Jyoti Bhaskar, ma'am. Thank you.
Thank you. Okay. Bye bye.